Today I will talk about urinary bladder cancer, how it forms, its risk factors, symptoms and the management. I am Dr. Sunny Goel. I am a consultant urologist at Epitome Hospitals, New Friends Colony. So what is a urinary bladder cancer? Urinary bladder cancer forms when the cells of the urinary bladder multiplies at an abnormal rate and it forms tumors or polyps or growth inside the bladder. Smokers are known to have a very high risk of bladder cancer as compared to non-smokers, and it is considered as the most common risk factor. And it has been widely studied that once you quit smoking, after 10 years the risk reduces by half. There are many other risk factors that includes age. After age of 55 it is common. Males are more common to have bladder cancer as compared to females. If you are working in industries like paint industry, chemical industry, dye industry, you are prone to have higher chances of bladder cancer due to exposure to toxins. If you have a family history of cancer and if you have taken treatment maybe for some other cancer in the form of radiation therapy for pelvic regions. So what are its symptoms? The most common and the earliest symptom is bleeding in urine. Bleeding can be in various forms. It can be minute, it can be quite large, associated with clots, and it can be intermittent. It happens and then it stops for few weeks to months, or it might be continuous. So any form of bleeding, you must consult your urologist to rule out bladder cancer and also other common problems which can cause bleeding in urine. Other symptoms can be painful micturition, frequent micturition, and even low back pain. So coming to management, when you suffer from these symptoms and you visit your nearby urologist, he first starts with ultrasonography of the abdomen and pelvis to look for the cause of bleeding. He also wants to look for other common causes of bleeding, like stones and UTI. And once he thinks that you probably might be suffering from bladder cancer, he will opt for other investigations like urine cytology, in which the pathologist looks for malignant cells inside the urine sample, CT scan of the abdomen and pelvis to know the exact site, the size and the location of the bladder tumor and its spread to various structures, nearby and distant structures, and cystoscopy. In cystoscopy, we insert a small metal tube inside your penis and go into the bladder to look for the growths. So in early stages, first we take a biopsy with the help of cystoscope to confirm our diagnosis, the type of bladder tumor and the grade of bladder tumor. In the early stages, if we remove the bladder tumor in its entirety with the help of cystoscope, followed by instillation of immunotherapy inside the bladder at certain intervals, is usually curative. And in advanced stages, when the bladder tumor has spread to its walls or maybe nearby structures, you might need a radical surgery in which the whole of the bladder is removed and the nearby structures containing the tumor are also removed. In more advanced stages, when the bladder cancer spread to distant organs like lungs, liver, or even bones in rare cases, you might need chemotherapy, for which we refer to medical oncologists. So friends, if you in your circle or your relatives are suffering from these symptoms of bladder cancer, you can visit us at Epitome Hospitals for your definitive treatment and cure. Thank you so much.